Hi parents, I'm Dr. E again. Today I would want to continue uh, to discuss regarding the topic of acute auditory hypersensitivity. Okay, in my previous slide or presentations, I have talked lengthy about what is acute auditory hypersensitivity, right? But today I just because the mother asked me, so what is the cause or the pathophysiological behind the acute auditory hypersensitivity? Okay, so to understand more on this topic, first we should know, or let me explain on a bit on the anatomy of the brain. So there's actually in the brain, actually there's a site or called thalamus. So this is actually the center of brain sensory gatekeeper. So the thalamus is a deep structure, or a deep structure in the brains that act as a central relay filter for almost all the sensory input, okay, from all over the body, okay, like sound, touch, vision, pain, proprioceptions, before it reaches the cortex of the brain. All right. So for example, this is the brain. Okay, this is the brain. So all the sounds from all other part of the brain will go into the spinal cord, all the way up and into the brains and reach the thalamus, which are the brain sensory gatekeeper. Okay, before it reach the cortex. All right, before the sensors reach the cortex, which transform into informations. All right. So this thalamus actually it act as a filter to filter out all these irrelevant, repetitive sounds, or it regulates intensity of a sensory signal. And it synchronizes. In other words, it helps to synchronize the sensory input with emotions and cognitive center. And it also helps to maintain the sensory calmness by preventing overload. So in simple term, okay, sorry, it's just a bit of technical, but just if you put it to in a simple term to put it this way, the thalamus decide what gets through, how strong is it, and when to ignore, and how the brain react both physically and emotionally. Basically, it's just like a gatekeeper. All right. So in a normal brain, okay, the thalamus filter the sound, okay, all the senses coming from different directions from the body. Then it pass through the thalamus, go to the cortex, and the cortex to interpret it correctly. All right, and from there it relay the informations or the senses to the another brain structure called amygdala. So this amygdala help us to regulate the emotion, our emotion based on the senses. So it help us to say, okay, stay calm. Okay, in return or in short, the nervous system remains regulated. All right. So I hope you understand. It's a bit technical. It's a bit technical. Okay, it's just like example. Okay, when I heard the sound, okay, heard sound of a thunder, or what happened that the thunder. So what happened that when we heard the sound of the thunder, it go in through the ears and transmit from the ears, it transmit the information, the sounds intensity, the sound frequency, it help to synchronize the sound and it bypass the thalamus. The thalamus will actually you act as a gatekeeper, how much sounds go in and enter the cortex. Okay, from there, the cortex actually will help to do the interpretations. Okay, and interpretation is such that, okay, I'm in a safe environment. So the past history, the past memory tell me that the thunder is nothing that yes, it's dangerous, but it's nothing that we have to be afraid of because I'm in the safe side. I'm inside the house. So indirectly, the cortex will send the signal to the amygdala, which actually help us to calm down. Okay, nothing to worry. It's fine. It's just a thunder, you know. So at the end, our anxiety level will remain calm and is not shooting up. All right. So that's the function of thalamus. I hope you understand. All right. So what happened that if patient with acute auditory hypersensitivity, okay, so there will be a thalamus, cortex, and amygdala dysfunction due to dysfunction of dysregulation of the thalamus function. Oh, so that's why the sounds can come in, from all over the place, being amplified. Okay, instead of being regulated, for example, all right, the sound being amplified instead of being regulated. And this amplification of sound causes discomfort, anxiety. All right. So in return, it translates into behavior response. For example, ear covering or ear covering, stimming, nothing to self-regulate. All right. Then after that, in return or in a severe form, the child will go into aggressions, agitation, or meltdown. So parents is not an intentional behavior. It is an escape or avoidance behavior, avoidance from the pain of the sound, the discomfort of the sound. So, as a parent, please do not shout or scold or hit the child as it could worsen the behavior. All right. And the other thing is, if you shout, you scold, it could escalate the conflict and the pain between the child and the parents. So, I hope it helps. If you want to know more, yes, please do your own research, do more reading on acute auditory hypersensitivity. All right. So by knowing the cause, the pathophysiological, and also the chemistry behind the acute auditory hypersensitivity, it does really helps you as a parent to understand your child conditions. And from there, we could actually formulate the treatments, whether it's a prevention or uh, perhaps cure to this particular condition if the underlying causes is being identified. Okay, so I hope it helps. I see you back in the other episode. Bye.